with her. And I'm joined in the studio this morning by Dr. Naa Asheley Ashietey, who is a chiropractor and certified ergonomist. And she is with the Nova Wellness Center here in Accra. Doc, you're welcome to the show.
Thank you.
So today we are talking about lower back pain and erectile dysfunction. And we are learning that there's some correlation between these two. But let's start with the basics. When we say someone is suffering from erectile dysfunction, what does this mean?
So erectile dysfunction happens in men, and that is when there's difficulty in achieving and or sustaining an erection for the purpose of sexual intercourse. So some people are not able to even achieve that erection. Some people may achieve it for a very short period of time, and both instances is what we'll term erectile dysfunction.
So, I mean, it goes without saying that it's for men.
Yes.
It's an issue that only men will have to deal with.
Yes.
A woman wouldn't have to deal with it, at least not directly.
Not in that way, not in the same way.
Okay.
Correct.
And it's got to do with the ability to hold it for the purposes of sex, achieving and sustaining.
Yes.
What would make someone have to deal with such a situation? What would cause such a thing?
So there are quite a number of causes of erectile dysfunction. I would say that number one would be stress. That's the psychological aspect of things. It may be stress from so many different things, doesn't allow your body to function well. That's what the research is saying. A lot of erectile dysfunction is from that type of stress. The number two, we're looking at having some form of cardiovascular disease. It could be blood pressure issues. It could be problems with your arteries. Your arteries are the blood vessels that move blood away from your heart to the different body parts. So if you have problems with the arteries that go to the male reproductive organ, then that could cause erectile dysfunction.
Okay.
It could also be nerve issues, which is where we come in to look at how the nerves that supply the male reproductive organ are working. And then we use those, we look at the problems in that area to solve the issue. And then we also have drugs. Sometimes being on certain medications, the secondary effect or the side effect could also be erectile dysfunction. So these, I would say, are the main causes that will lead to erectile dysfunction.
So 4 main ones that you identify: the issues of stress, issues to do with your arteries, and then you also talk about the vein. Is it the veins?
So the blood vessels.
The vessels,
yes,
I should say. The
vessels,
blood vessels,
yes,
which will typically allow for
blood
free
flow to those organs.
And then the final one being...
So we talked about the
issue
nerve,
of
and then we talked about drugs.
the drugs, the
being
drug
a
use.
secondary effects. There are certain medications that when you take would cause those problems.
Let's take them one by one, maybe starting from the last. What kind of medications have the potential side effect of resulting in erectile dysfunction?
Most common would be the antihypertensives, so your blood pressure medications. Yes, there are different types of blood pressure medications. So there are some of them that unfortunately may be controlling your blood pressure well, but would affect how your male reproductive organ would function. So it would be good to have a conversation with your doctor, with your medical practitioner, and say, unfortunately, these are the side effects that I'm having since I've been taking this medication. And then they can see if they can change it, find something else that can work better and still have your reproductive organ function well.
So for someone who is hypertensive, the person is likely, and I'm talking about a man here, is likely to suffer from erectile dysfunction, not because of the condition itself, but because of the treatment for the condition.
Absolutely, because of the medication. And also, it's very, very important to note that there are other things that could come into play even when you're taking blood pressure medication. For instance, if you're taking your blood pressure medication but you're overweight, you don't have a good diet, you don't do any form of exercise, those things can also lead to the erectile dysfunction. You understand? So we don't want to focus too much on the medication part. You need to make sure that everything else is also working very well. Like you're eating well, you're exercising, you're not smoking, you're not drinking too much alcohol, because you can be taking your medication and not doing these things properly, and that can still lead to the erectile dysfunction problem. So medications that you have to be on is important, but we also need to make sure that we're living a good lifestyle to support all our body's functions.
And I'm happy you went there. The use of drugs, let me say cigarette smoking and alcohol, do they have a potential effect on your ability to achieve and sustain an erection?
So some of the substances that are in the cigarettes or the things that you smoke and alcohol can affect the way your nerves function.
So the connection is to the nerve.
Yes. So we call something neurotransmitters, how quickly your nerves, flow to those organs from the brain, from the spinal cord, so that those organs can work well. So when your body is overly stimulated by some of these substances and alcohol and tobacco products and all these things, sometimes your neurotransmission becomes slow, and then those organs don't function well.
And because you mentioned stimulation, there has been now there's a plethora of energy drinks, which people take to keep them more active because they have a lot more work to do. And stimulation, in essence, do energy drinks have a potential of affecting one's ability to achieve and sustain an erection?
So energy drinks, I don't recommend at all. First of all, a lot of them, it's just all sugar. And we have to realize that already our diet is so high in sugar. So when you're also putting in that much sugar and you're maybe not even burning it off, it will lead to other problems. Sugar, caffeine is also another one. All these are stimulants. And I mean, coffee here and there, a bit of caffeine here and there, no big deal. But when you're taking too much of it, it's a stimulant. So it can cause too much activity in different parts of your body and lead to other problems. So
including erectile dysfunction.
Exactly. So let's say somebody who is already hypertensive, you have high blood pressure, meaning that your heart is overworking to pump blood around your body, and then you add too much sugar or too much caffeine, you overstimulate your heart, and that can even take your blood pressure even higher, you understand, and cause more problems. So we really need to pay attention to the use of all these drugs, and sometimes it's not even just the alcohol and the cigarettes and all the things that we smoke these days. There are so many unapproved different types of what
like the shisha and all of those kinds of things.
So many different things, and it could be psychological that people think that it works, but the problem is it may be affecting other things. You need to realize that your kidney, your liver, all these organs are responsible for removing toxic waste from your body. So if you have too much of that, then you overburden those organs, and that can also lead to other issues.
That's really concerning. I mean, especially on the issue of the coffee and the caffeinated product. Is tea fine?
It's fine.
Tea. Is tea fine?
Tea is fine. Tea has a lot of antioxidants, which is great for the body.
Okay.
It helps your cells and your organ systems to work better, because we need the antioxidants to help remove some dirt and stuff from our body cells. So tea is great.
So you recommend tea over coffee on any day?
Yes, I would.
Oh,
I would.
I'm sure.
And again, coffee, like I said earlier on, in moderation is fine.
Okay.
You know, a cup a day is fine. But the problem is you have a cup of coffee a day. You have some fizzy drink, which also has some caffeine. And then you also have an energy drink, which also has some caffeine. So at the end of the day, you may not have had just a cup of coffee. You may have had lots of different substances with caffeine in it. And over a long period of time, day after day, that can lead to some of these problems.
Let's talk about the issue of stress. And the work that a lot of us do now make us prone to stress, being stressed, and very easily so. How does one control the level of stress that they deal with so that does not result in a very scary issue of erectile dysfunction?
So one way that I really advise people to manage stress is to be active, to have some form of physical activity going on. That really helps to negate the effects of stress on your body. For instance, when you're stressed, it reduces your metabolic activity. So when you exercise now, you increase that metabolic activity to negate that effect of stress. You're able to improve your circulation. You're able to improve your respiratory system. You breathe better and all those things so that it will help manage the stress better. But if you're stressed and you don't do any of these things to help your body to continue to thrive in the right way, then over a long period of time, you realize that you're going to develop so many other diseases just because you are not managing the stress well.
So for you, your recommendation is being active.
Being active, eating well. Again, when you're stressed and you don't put the right substances in your body, that is when all sorts of things can grow, because your environment, your body's environment is toxic. So that's when you really need to drink a lot of water. You need to eat more fruits and vegetables. And even with things like erectile dysfunction, you realize that if you're eating the natural foods, green foods, fruits and vegetables, spices, all those things can also help. All those things can help. But if your food is also full of oil, fats, a lot of sugar, then there's a problem, and you don't give your environment, your body's environment, that opportunity to thrive.
And is there a way to prevent? I mean, we've spoken about some of the things. We've spoken about activity and all of that. About the foods, are there certain foods that help, especially with circulation of blood better, help open up your blood vessels? Any specifics that can help in this regard?
So as far as research is showing, a lot of our spicy foods, okay, so your garlic, ginger, pepper. When it comes to erectile dysfunction, there's a lot of research online about cayenne pepper. So that's the red pepper. The red pepper, okay, because there's an ingredient in it that is supposed to stimulate the vessels so that it helps it to open up better. Then there's blood flow. So here in Ghana, if you look at our the red, thin, long, dry pepper, yes, it's supposed to have a lot of something called capsaicin.
Okay.
So that is supposed to help with your blood vessels and therefore circulation. So we need to eat a lot more of these foods that are readily available.
I see.
Ginger, red pepper, garlic, the greens, green leafy vegetables. So your dandelion, your contomere, all those have a lot of vitamin Bs, which are good for the nerves. And like I said, erection has got to do with blood circulation and nerve flow. So when you're able to increase the amount of vitamin Bs in your diet, it will help stimulate your nerves better.
Maybe just before we go to potential correction, if someone is suffering from this erectile dysfunction. Are there certain fruits like, I mean, people, traditionally it's mentioned that, tiger nuts tends to be good. There are other elements like bromelain in pineapple, potassium in bananas, beetroot and all. Do they really practically have any positive benefit in that regard?
So that's what the research is saying, even watermelons as well. So, anytime you have these bright colored fruits, okay, anything red, anything yellow, tomatoes, all those things, there are very, very nutritious elements in them that help with a variety of things. So if you have a really, really balanced diet where you're adding a lot of your fruits, your vegetables, a variety of them, you realize that you'll be able to get a little bit here and there. The thing with these fruits and vegetables is that a lot of the times you need to make it a lifestyle, to eat it. If it's every day, it's every day, so that you have quite a number accumulating in your system for it to be able to work. So you have to do it over a long period of time. Most people may start, I'm going to eat a lot of fruits and vegetables this month. Maybe 1 week, 2 weeks,
then
they
they
realize
stop.
that they can't keep up with it, and so you won't get that result. And that's why sometimes supplements can also come in, because if you are not able to take in that many fruits and vegetables, then you could also look at certain supplements which has the right amount of those nutrients that you need, and then you can take those supplements.
Now let's talk about the solution. I mean, from a curative position, we've spoken heavily about the preventative side. If someone is suffering from erectile dysfunction, is there a cure for it?
So a lot of it can be treated. Obviously, there's so many different things that can cause erectile dysfunction. So you need to have it checked. You don't need to go speak to your brother about it and tell them this is what's going on and let them say, go buy A, B, C, D. You need to go to your medical doctor, report it. Like I said, it could be secondary from medication. It could be secondary from other diseases. There's so many things that can cause it. But we at Dover Wellness Center look at the spine, okay, and the misalignment in the lumbar spine.
Beautiful.
That cause or that interrupt nerve flow to the male reproductive organ and lead to erectile dysfunction. So we look at that particular cause, and then we treat the spine, make sure we remove any misalignments from the lumbar spine, and that usually helps a lot of men. And we also realize that some people, they come into our clinic and they come in because they have low back pain. You know, so when we do the assessments and we do our history and all that, then they say, oh, I actually have this as well. And then when you look closely at the x-rays and when you look closely at the MRIs or other tests, then you realize that there could be a problem around the L3, L4 nerve area, which also supplies information to the male reproductive organ. So once you're able to reduce the nerve pressure there, lower back pain goes down, as well as the erectile dysfunction.
And there's a clear connection between lower back pain and erectile dysfunction.
Absolutely. And for those of us who are watching us, this is the lumbar spine, that's the lower back area.
Yeah.
And as you can see, these yellow things here represent the nerves. So if you have a misaligned bone right here in your lower back, which is putting pressure on the nerve going to the reproductive organ, then that organ is not going to get that information or instruction to work well.
The flow,
yes. So that's why we use the chiropractic adjustments to work on the bone, get it to better align, and then the nerves can flow. Or sometimes, for some people, they may have what we call disc bulges, kind of like this red thing here.
Yeah.
You can see that the disc is very close to the nerve. So here, if somebody has a disc bulge, then we would use what we call the spinal decompression system.
It's come back again.
Yes. So that's what we use the decompression to do, to reduce the bulge so that the nerve is free and information can flow to that organ better.
So just to confirm my understanding from last week, the spinal decompression is releasing the pressure within the spine.
Very good.
Okay. So for those of you watching on Facebook, you see there are a lot of graphics there explaining the situation, and it's a very serious issue. You don't want to find yourself in this situation. So please, I think that the messages are very clear. Some people use Viagra and Cialis, among others, in their various generic forms and other specific forms. Do they help?
So yes, I mean, those are pharmaceutical drugs that medical doctors would prescribe for people suffering from erectile dysfunction. And yes, there's a lot of research showing that for most people
They do work.
Yes, but again, it's you don't want to depend on that forever for the rest of your life. So I have patients who would ask me, is it okay to use those? And my answer is, it's okay, but you also need to work on other lifestyle changes that you can make. So if you're overweight, for instance, and you only want to depend on your Viagra so that you can enjoy your sexual intercourse, it can only work till a certain
Point in time.
So you still need to work on losing some weight. You still need to work on improving your cardiovascular system so that you don't have to fully depend on your Viagra or Cialis.
And so for today, the conversation has been on lower back pain and erectile dysfunction. Before we go, Doc, just give us our 3 Ds, the things to do and not to do, the 3 Ds as a quick wrap of the action points moving from today's conversation.
Okay, so the 3 Ds for today. 1, let's look at the lifestyle changes. Okay, so if you know you're drinking too much alcohol, that can also lead to erectile dysfunction. So that will be number 1 thing that you can quit like right now. Smoking also is one thing that you could start working on quitting. And if you need help with these things, sometimes we say it, but it may not be that easy to just quit. There's places you can go to and seek help if you need to quit these bad habits. And then exercise. Getting more active, having more physical activity. Because a lot of people, you're sitting in the office Monday to Friday, Saturday they rest. You realize that you just keep going without any physical activity. When you do something and you're able to get your heart rate up, it really helps the blood flow and you improve the circulation to your reproductive organ, and that would also help. So exercise is key. And then also the use of all these unapproved aphrodisiacs and whatnot, which are supposed to improve with the male reproductive organ. People need to understand that it does have its side effects.
Yes.
Even if you think it's effective at what it does, think about what is happening to other body organs.
Your kidneys,
your liver, all those things. It's very, very important. So there are medications that if your medical doctor deems it necessary for you to be on, can prescribe. Otherwise, I would highly recommend using our natural foods, our vegetables. We have great natural spices. There's ginger everywhere. There's pepper. Those things can also help. So those will be the 3 main Ds that we'll talk about today. But just to add one more, I'll say that people should really take a look at their spines, the lower back spine in particular, the lumbar spine. So if you've been suffering from a lot of back pain, lower back pain, and you realize that as you're struggling with the back pain, this particular side of things or your male reproductive organ is also not working as well, then don't ignore it and do everything else. You need to have your spine checked. And corrected.
And you can clearly get that kind of check at the Nova Wellness Center, who is sponsoring this particular segment of the Asaase Breakfast Show. And we've had Dr. Naa Asheley Ashietey, who's been talking to us today about lower back pain and erectile dysfunction. And that was my last add-on. Checking your posture. Be consistent with your posture. somebody has disciplined. In fact, two gentlemen have disciplined themselves in the studio right now. And that's very good, because you can't afford to goo your because for you, the men, that's a big problem. You lose all your tights and all of that. So take very good care of that. And that's been our segment today on the Health Post.